As we get older, some people tend to avoid physical activity, thinking that they are doing better for their body, or they are wrong. It is very important that everyone engages in some sort of physical activity in their daily routine. That is where walking comes in hand. Statistics show that only 20% of Americans make the daily recommendation of what they're supposed to be walking. Non-walkers are more likely to suffer from depression or dementia, not to mention losing muscle strength, flexibility, and also blood flow through the brain. But one can avoid all of this by just going on daily walks. Instead of waiting for an elevator to come down, go down the stairs. If there is a dog in the family, take him on daily walks. When talking about people that have mental illness or some type of disorder, exercise plays a big role in their life. Many people that have an illness lack the inspiration to contribute in some physical activity because of many reasons. Reasons like the side effect of the medication is too strong to be able to perform anything. People with severe mental illness experience premature mortality or excess morbidity caused by preventable and treatable physical illness. Another thing that a lot of people suffer from is mental stress, which is no good for the hippocampal structure and
Obesity is one of the most serious problems facing youth today. In addition, statistics have shown that more than 1 in 3 children in the United States are either overweight or obese. Obesity has increased throughout the years, and numerous medical and psychological consequences have occurred, like, for instance, impaired glucose tolerance, cardiovascular disease, and low self-esteem. A involvement of parenting has been linked to a huge success. Research has shown that parenting behaviors relating to physical activity and nutrition can increase a better impact to the childhood. Families play an important role on the adolescent behavior and outcome. An improvement on a parent-to-child relationship can influence the likelihood of obesity by helping children to cope more efficiently with stress and opening more for a positive, healthy lifestyle. In addition to lifestyle behaviors and eating attributes, parenting youth relationship quality could help develop a adolescent depression. Children and adolescents with obesity are at a greater risk for bone and joint problems, sleep and psychological problems, and social. A kid with obesity is not only going to be facing with healthy problems, but also with social problems like bullying. Obesity kids are the ones who get bullied in school, and that causes physical problems and beyond.
While maintaining good physical health is important for the overall well-being of a person, mental health is just as important, if not more. Think about the millions of people who are perfectly physically healthy but suffer from mental disorders such as depression, anxiety, obsessive-compulsive disorders, and so on. These people do not lead a healthy or happy lifestyle. Thus, this is why positive psychology is crucial in one's life. Positive psychology is defined as the study of focusing on the positive aspects and characters such as strengths, virtues, and talents, and how to enhance these in order to reach optimal human functioning, according to the essential elements of effectiveness. By focusing on the positive aspects of your life, like your character, strengths, your interests, and attributes, and neglecting the negative aspects of your life, you can lead a more successful and happier life. Experts say that effective individuals see problems in their lives as something they can gain meaning from and receive a sense of control. Thus, they will try to find a way to be happy and satisfied at all times, no matter how bad a situation may be. This is especially important for children. Using positive psychology on children could be the beginning of a more positive and mentally healthier generation. According to Christopher Peterson in his Positive Psychology article, using this method reframes how we look at children, how we treat children, and how we raise them in a more positive light. Even if it is extremely important to help children eliminate problems, it is also just as important to help them make positive connections in the world and guide them to thrive using these connections. Moving our focus toward helping children have more positive experiences like happiness and flow, helping them build lasting strengths and character traits, and surrounding them with positive relationships all around them, we can change the coming generation.
Even if there is a lack of research for how a healthy lifestyle can make an essential difference in the life of people with mental illness and substance dependency, it's important to point out how the absence of a healthy lifestyle leads to the premature death of these individuals. Actually, the life expectancy of persons with serious mental illness is an alarming 20 to 30 years less than the average. They also have less healthy habits, including lower consumption of fruits, vegetables, and fiber. Therefore, a critical step should be taken toward improving the health of individuals with serious mental illness, and the step is to develop lifestyle modifications. These same types of modifications can also be followed by people with substance dependency. Modifications on how to eat properly, exercise, relax, and improve their self-esteem. There is evidence that healthy behaviors will lead to the improvement of abstinence rates. Because when there is an inclusion of healthy lifestyle behaviors for these individuals, there can be a remarkable difference on the rates of detoxification. Even if it's known how for humans stress and anxiety happen to be the cause of an initial substance use, it can also be said that if humans will live a healthy life, they won't be part of the population who have limited access or infrequent use of lifestyle behaviors that can eventually lead them to relapse. There is clearly a need to enhance effectiveness of healthy lifestyle intervention for people with mental illness and substance dependence, a change in their life that can lead them to live one more day than it's expected.
According to Abascal, Brucato, Stephenson, and Brucato 2012, page 123, there are many different types of stress. The first one is eustress, which is the positive stress. This type of stress refers to stress where people are required to do something positive for them, such as study for a test. On the other hand, there is another type of stress called distress. This stress is the negative one because this can make a person sick. Also, according to Clerk, Asad and Brown 2012, stress illness include 5 types of stress that can cause physical symptoms: prolonged effect from stress in childhood, current stress, post-traumatic stress, depression, and anxiety. That is to say, among kind of stress that can be defined as 5 types of stress, first is prolonged stress, which is effect from childhood. It is the type of stress that caused in children by moving to another country, changing culture, or changing school, for example. Second, daily stress is defined as the stress people have in their daily life, such as financial or school exam. Third, post-traumatic stress is a sort of stress that is caused by a bad experience. For example, this includes trauma that military people face when they come back home after going to war. Finally, fourth and fifth are depression and anxiety, which are illness that come from sad or unhappy experience, and when the person who suffers from that does not know how to get rid of the pain.
Massage therapy for a healthy lifestyle. There is no doubt that since the beginning of times, touch, has been a part of a healing process for physical and mental needs. Big countries like China, India, and Egypt have used this method for healthy lifestyle since before Christ. Hippocrates, the father of medicine, used to describe it as the art of touch. Even animals use it when their babies are born or to heal themselves when wounded. In a series of studies, preterm infants in an intensive care unit were given 15-minute massages every day while still in the incubator. The treated infants compared with control infants gained 47% more weight and had less visits to the hospitals per year than those who did not receive massage therapy. Massage therapy can also help babies if given to the mothers while pregnant. Prenatal massages can significantly reduce anxiety, depression, related stress hormones, and illness. As well known, massage therapy can also reduce pain after an injury or excessive exercise. Also increase metabolism, reduce pain, increase serotonin hormones, increase quality sleep, reduce spasms, pain, and stress. 15-minute massages a month can give you a better quality and healthier lifestyle.
Latin children seem to have asthma in the United States is the most elevated if compared to different ethnic groups. Latinos are higher graded on asthma and lower in consulate services. Children are exposed to the smoke of cigarettes in their home, converting them a second-hand smoker. Some parents they don't know the danger effect to smoke near to them. They don't have to quit smoking, but they have to learn about the cigarette effect on children with asthma. For that reason, health bilingual educator went to their home to educate the parent and at the same time use monitoring the children's room to measure the amount of smoke. It has been clearly exposed that caregivers who continue to smoke despite the child asthma would need an intervention that will provide problem solving and education about how to quit one and for all. Smoking during pregnancy is the principal cause of complications during pregnancy, such as birth defect, infant death, and other diseases. The result that demonstrates the stress of being a single parent is associated with the difficulties of quitting smoking during pregnancy. Unfortunately, the majority of the women proceed smoking during the pregnancy, while the minority quit smoking spontaneously. It is believed that women with less education have more chance of smoking. Another factor can be their surrounding or their habit. Some reason that can help a woman quit smoking during the pregnancy can be continued with their education, have friends that do not smoke, or try to resolve the problem without cigarettes.